It is 8:30 on March 2nd, 2022. And we are going to call the Senate Public Health and Welfare Committee to order. But before we get started, just a quick housekeeping and just a little announcement. Housekeeping part is when we get into the confirmation hearing, just as a reminder, we are going to start to my left with Senator Thompson and work our way around, and we're going to end with Senator Steffen for 5 minutes of questions and answers with the Secretary. It will be a confirmation hearing. I was planning on having a vote afterwards, but if we do not have all our members, we will hold till tomorrow. I know Senator Baumgardner is out for, might be here late, but she might not. So depending on that is what we'll do on the vote. On something else, just I guess a point of personal privilege, not really an announcement. We do have a special guest with us today, Miss Abby Campbell. It's her birthday today, and she's with us from Olathe. So if everybody would wish her a happy birthday. And she is Senator Gossage's constituent. So with that, we are going to go ahead and open up the confirmation hearing for Janet Stanek, Secretary of Kansas Department of Health and Environment. Janet, welcome to the committee. Do you have opening comments that you'd like to?
I have a statement, if that's okay.
That is perfect.
Good to see everyone again. Thank you. So thank you, Mr. Chairman, Vice Chair, Ranking Member, and members of the committee. I think you know my name is Janet Stanek, and I've met all of you, and I'm honored for the opportunity to appear before you in support of my appointment as the Secretary of the Kansas Department of Health and Environment. Kansas has been my home for the past 24 years. My husband, Mike, who's back there, is here with me today, and I raised our 2 boys here in Topeka, and now we are blessed to watch our grandsons, 2 of them, age 9 and 15, call Kansas their home too. I'm a former healthcare executive with a 38-year career that spans 7 different hospitals in 3 states. I have a bachelor's and a master's degree, and more recently embarked upon a 2-year graduate certificate program in population health, which focused on the social determinants of health and other environmental factors that impacts the overall well-being of people. My career began in rural hospital as a medical records director. From there, I moved on to positions in larger hospitals and eventually ended up with a very impactful and successful career at Stormont Vail right here in Topeka, where I spent the last 11 of 21 years as the Chief Operating Officer and Senior Vice President. While my role at Stormont Vail allowed me to assist with revolutionizing the care delivery system for thousands of people across Kansas, the work I did as the director of the State Employee Health Benefits Plan here at the state allowed me to utilize my knowledge and expertise in population health in a more significant way. Under my leadership in that role, we worked closely and collaboratively with the Healthcare Commission to ensure that the $500 million State Employee Health Plan was cost-effective and created as much value as possible for our insured population of roughly 85,000 lives, which included state employees, their families, and retirees. Outside of work in my family, I'm committed to making Kansas a better place through my service on not-for-profit boards that focus on meeting the needs of the most vulnerable members of our state. My education, professional experience, and community service affirm my commitment to health care and challenged me to rethink the idea of care by moving from a sick care mentality to whole person and community care. I am confident that as Secretary, I'm capable to continue with what I've been doing as well, and I'm well equipped to carry out KDHE's mission, which is to protect and improve the health and environment of all Kansans. Since I've stepped in as acting Secretary 3 months ago, I've immersed myself in the work of the agency divisions and worked closely with the staff to support their endeavors. I've appointed a new state health officer, put focus on workforce recruitment and retention, prioritize stakeholder engagement, and from all divisions, health, Medicaid, as well as the environmental sector. I've also had the distinct privilege to meet and get to know each and every one of the committee members today and many more in the legislature in my short time here. In those meetings, I listened to and took heart to the things that matter to you most. I provided you information you requested and answers to questions that you had in very rapid order. This is a testament to my work style and, again, my commitment to you in my role. One of you, in fact, specifically asked for me to bring today my top 10 priorities if confirmed as secretary, so I'm going to give you a short summary of them now. 1, move beyond COVID. As we transition towards steady state operations, I'll be evaluating practices that are in place to determine now how KDHE can be the calming, confident, and reassuring voice for the state as we move forward. I want to lead by example. 2, back to basics of KDHE. I want to affirm a solid staffing and resource infrastructure that will continue to allow us to carry out our work. 3, rebuild confidence for the state agency. I will work toward improving transparency with the public, legislators, and stakeholders in our agency. 4, communication with policymakers, identifying the appropriate forum to be able to provide relevant feedback and rationale on the agency's actions to the legislature, will be a priority for me. 5, fiscal responsibility. KDHE is responsible for managing millions in state and federal dollars. Maximizing opportunities and spending wisely will be my focus. 6, stakeholder engagement, identifying key stakeholders and asking, are we being good partners? Given the information we exchange, how can we best establish best practices and good policy for Kansans? 7, workforce recruitment and retention. I want to review the policies and practices we have in place to recruit and retain qualified talent to KDHE beyond compensation. 8, interagency collaboration. I've been reaching out to other state agencies to identify opportunities for collaboration. And as secretary, I hope to take that to the next level. 9, improving communications between industry and supporting workforce development. KDHE provides a vast amount of information to various stakeholders throughout its 3 divisions. I want to break down the silos, improve communication between the divisions for a more efficient workflow. And 10, the future of public health. Along with the rest of the country, I will be focused on what the future of public health for Kansans will look like and will be working with all of you in this regard. For nearly 40 years, I've dedicated my life to my profession and improving the health and safety of my community. Because of my experiences and as an accomplished executive and nonprofit volunteer, I believe I am uniquely qualified to lead the state's 3rd largest agency, its 3 equally distinct divisions, public health, environment, and healthcare finance, also known as Medicaid, and the millions of people it serves every day. My team and I share in your commitment to support the people of Kansas. I look forward to our partnership, and I'm ready to roll up my sleeves and work with you. And thank you very much for having me here today, and I'm happy to answer more questions.
Madam Secretary, if you wouldn't mind, on number 4, I apologize, I was slow in writing and didn't catch what your number 4 was.
Number 4 was communication with policymakers, identifying appropriate forums, being able to provide relevant feedback to help you all in your decision-making, rationale on the agency's actions, provide you rationale on actions to the legislature, and how we do that in an impactful way.
Okay. Thank you very much. And committee, I forgot at the beginning, you guys all had a homework assignment. You had a packet. You're supposed to bring it. So hopefully everybody completed their homework assignment. And you need to turn that in after the meeting because you will be graded on it. And it will be posted online. So at this point, yeah, the grade, not the packet. Thank you for that clarification. The Vice Chair keeps me in line sometimes. It's a tough job. We're going to start with Senator Thompson for 5 minutes. And I do ask that all committee members please keep within your 5 minutes so everybody has an opportunity to ask their questions. Senator Thompson.
Somebody going to be keeping time on me. I'm not used to doing that very well.
We will have someone keep, it looks like Connor's volunteering.
Okay, very good.
He wants to do it.
I appreciate that very much.
Thank you, Connor.
Thank you, Mr. Chair, and thank you for being here. We appreciate that. We had a good conversation in my office, and I appreciate that. Appreciate you reaching out. Obviously, I looked at all of your resume, and to me, the most important thing is policy decisions and what you're going to make going forward, because I think that sets a tone, as we saw in the last couple of years. It was a very monolithic approach to how we dealt with COVID. One of the goals that I heard you talk about was reinstilling confidence in KDHE in the public health, how would you go about doing that, given the fact that there's been a lot of misinformation? There was a John Hopkins study that just came out that talked about the fact that the lockdowns did not work, and a lot of the measures did not work. So how would you go about reinstilling confidence?
Well, I think engaging people is one thing. I explained to many of you, yourself included, when I met with you, my style is not to make decisions without having some basis for doing so. I mentioned in my priorities, getting stakeholder input and really understanding how a policy decision is going to impact not just the state or KDHE, but everybody, and making sure we have a very good understanding of our stakeholder impact, and then working with those stakeholders, even if we have to implement a policy that's not popular, doing that in a way that is inclusive. And I think that's one way. The other way is just to be honest about things reasons we do things, and then if there's a change, why we need to change it. I think communication, it's always about communication and understanding. And I think I heard from many of you that there were some suggestion that KDHE wasn't responsive, says they were going to get information back and never did, et cetera. I think I proved to you that that is all of you. I had a lot of response that I provided ahead of this meeting to all of you on many different topics. That's our job, to get you that, and not only just hand you information, but put explanation and offer more discussion about it, et cetera. So I think you earn respect back by following through on what you say you're going to do, and that's how I'll do it.
I guess one of the big concerns, and we discussed this, was that the information that the public was following was primarily from the CDC, and yet there was a huge body of growing evidence that showed that some of the lockdowns, the masking, the even waiting on vaccines wasn't working. And how would you? Are you going to continue to follow down the path of following the CDC, or will you consider other scientific evidence when making decisions? And the reason I'm focusing on this is because at some point you may be faced with a similar situation and have to make some of these tough decisions.
Yeah, we are typically following CDC. That's very typical for a state public health agency. We network nationally with other state agencies, national groups, and CDC will be who we will follow guidance from. Now, again, back to explaining and understanding what their decisions and what their recommendations are. Doesn't mean everyone will follow that. The state has no mandates, so when KDHE puts out a guidance from CDC, it is just guidance.
A lot of people felt like, though, it was, businesses shut down, restaurants, everybody else. I guess the bottom line is, if confirmed for the decision, you may have to choose between controlling the spread of disease and suspension of individual rights. Which would you say supersedes the other?
I don't think I would ever be in a position to suspend individual rights, and as far as following guidance and again would be inclusive in those discussions and decisions about why we would want to make a recommendation about the CDC's guidance. It would, again, be an individual choice about whether people follow that. Our goal is to protect the safety and health and environment of Kansans, and I have to follow what's in statute and what the guidance is.
Do you agree with vaccine mandates?
There are no mandates.
They're for kids going to school. Things.
There are exemptions from that.
Okay.
There's a schedule. Mm-hmm.
But would you agree that there could be religious exemptions or other exemptions for parents who want to go to school or want to send their kids to school without vaccines?
Do I believe there will be?
Or should be?
There are. That we follow state guidance, and there are.
Senator Thompson, 5 minutes is up, so if you can conclude your question and answer, we'll move on to the next one.
I think
Thank you.
I'll just stop right there.
Thank you, sir.
Thank you.
Thank you. Senator Erickson.
Thank you, Mr. Chair. Thank you so much for being
Thank you.
here. Good to see you
Good
again.
to see you.
I've reviewed your packet, and as I look at your professional experience, your education, your background that you spoke to in your opening statement, it's obvious to me that you have on paper the qualifications for this position. So my questions are going to be a little bit broader and general to try to kind of get at how you would handle certain situations. So my first question is, describe yourself in one word.
Fair.
As Secretary of KDHE, who do you work for?
I work for the people of Kansas.
And how would you define success in your role as Secretary of KDHE? So, as you would reflect back over your tenure as Secretary, how would you say, what would be the qualifications or the standards or accomplishments that would make you say, I was successful in that role?
Well, first of all, from the people of Kansas perspective, I'd like to see improvements in our health rankings and the initiatives that we have move forward. I'd like to see that an environment that we're meeting the needs of the whole state. As you know, we have many different needs for environment in a rural area compared to a urban area. So I'd like to think that we are providing support, loans, infrastructure improvements, and see some of those come to fruition. In Medicaid, I'd like to see us have a solid operation, have members get great customer service, and get access to care. And I'd also like to think that and not only me, but KDHE had an excellent reputation at the end of it all with the legislature, no matter who was in it.
Okay, thank you.
Thank you.
So up to this point in your life, what are you most proud of?
Well, family always first, and my sons and my grandkids. But I'm also proud, I consider, I forgot my husband, that my long marriage, 37 years this year, and I'm proud of what we've been able to do. I think that I consider myself self-made, and I'm proud of all the people that I've been able to help by working hard and not letting up on my goals. And so that's my personal goal, but I do like to help people, and I feel like I've helped a lot of people throughout my career, not just in the professional side, but in my community work as well, and I'm really proud of what I've been able to do there.
This isn't one that I'd written down, but you prompted a question for me. So what would you attribute your success to, being smart or working hard?
Working hard.
And my final question, Mr. Chair, is what makes you memorable?
My personality.
Thank you. Thank you, Mr. Chair.
Thank you, Senator Erickson. And Madam Secretary, you had a chance to make amends for your husband. You could have said your husband was what made you memorable, just throwing that out there.
I'm going to get it.
Under O'Shea.
Thank you, Mr. Chair. Thanks for being here today. Health is, to me, the term health is changing, and so it's not, we always think of physical health, but I think of well-being in the different aspects. So there's physical, there's community, financial, social, purpose and vocation, and spiritual. And I was really disappointed when COVID hit and the way our government responded was so focused on physical and not the other aspects of health. I think by disregarding those other aspects, the physical tanked for so many people. And so what's your view of well-being and how the department might start to focus a little bit more holistically on the idea of health?
Right. I think when I referenced my continuing education, my graduate certificate in population health, that's what population health is all about. It's about the whole being, whether it's financial, mental health, whether it's food security, all of those things, people having transportation, how do we get people a job, what things lead to another. I started down that journey, some of that based on my work when I was on the board of the Kansas Health Institute, but also Stormont Vale also started really focusing away from sick care to well care, and that well care included more of the socioeconomic determinants of health. Also in the health plan, some of the things we were working on there and some of the programs we offered our employees. We have a really wonderful employee assistance program at the state, if you're not familiar with that. We worked on promoting a lot of the programs there in the health plan, but it wasn't really health related. It was about those things I'm talking about, whether it was informing people about, again, mental health issues or getting counseling to help them through COVID and whatnot. I also had some of that with my role at Stormont Vale with having behavioral health under my area of my scope of responsibility for 11 years, and the things that we worked on there and integrating the acute care setting with the behavioral health care setting more so. So what do I think KDHE can do? I think we do a number of things along those lines now, but I think that we can elevate some of that work through our stakeholders. As you know, we don't just work alone in KDHE on some of those initiatives. We work with stakeholders throughout the state, and we have a lot of opportunity to help people get back to normal, and I totally support that. And again, that's all about population health.
Thank you. So my next question somewhat goes with that. We worked together a little bit when I was at the Topeka Chamber. One of the initiatives Shawnee County had was Heartland Healthy Neighborhoods. And so we brought together stakeholders that were interested in health, and we had different work groups. And one of the ones I sat on for a while was about trails and bicycle lanes and things like that. Anyhow, I saw that a coalition like that, really grassroots, boots on the ground, how much that could influence public health. One time we threw a Shawnee County exercise event and there were hundreds of people there. And so, and we often talked about some of the state's initiatives, but how do you intend to reach those communities at that level of grassroots collaboration?
Thank you for that question. I've already started some of that work. I'm sitting in many, many meetings with bureau directors and below to get to know who our stakeholder groups are and where they come from, and I'm finding it fascinating, and that's one way to learn is to do. I'm a doer, so I think being there and being in the present moment with them is to understand. I also plan on taking visits out to all communities in Kansas. Right now, I haven't been able to, of course, because of just onboarding and whatnot. But I think you can't sit in Topeka and then understand what people need in the land that we live in. And so I recently sat through, though, one of the award ceremonies, and I'm failing to remember which one it was for, but it was for people that got awards for doing these types of initiatives in their communities, and it was fascinating to hear. And one person that built trails with no formal funding and just did it on his own and was able to gather support, and I love to hear about that because I think there's a lot you can do. I agree. It's not always about having a ton of money. It's about getting people on board with the cause. So I'm excited to get into grassroots work.
Cool, thank you. One more real quick. I'm encouraged that you've worked outside of government, and so when I think about the private sector versus government, there's usually differences in some efficiencies and things like that, and so how do you intend to bring what you've learned from Stormont Vale with the efficiencies of the workplace into the government?
Yeah, I think that within my own agency, I have a lot of opportunities for that because although I have 3 divisions, they all intersect one way or the other to health and environment. And I believe that there's a lot of opportunity, particularly in public health and maybe some of the things we do with air, water quality, public health, and then even on the Medicaid side, they have a lot of the same initiatives. And so I'm excited about working together with those divisions as an example, if that helps.
Senator Petty.
Thank you. And Secretary, thank you for being here.
Thanks.
It's been a pleasure to be able to spend time and visit with you. I know earlier you mentioned about your 38 years of experience in the healthcare and operations and management, and not just in Kansas, but in several states. And I'm just wondering if you could share how have these extensive experiences helped you transition into this secretary role with the Department of Health and Environment?
Oh, thanks. I think I started, as noted, in small rural hospitals, where you had a title, but you had many hats. So I have, again, done a lot of hands-on work in areas from soup to nuts, all the way up through a hospital environment, and along the way, progressively increased my managerial responsibility. So learning by mistakes, learning the hard way, learning by some successes, and tying that all together. And I mean, 7 different hospitals, 3 different states, different sizes, different makeups of personnel and medical staff, et cetera. Regulations are different in different states. So I think I had a lot of focus on regulatory in my past positions, and I think, obviously, I'm in a very regulated environment. So I think between that and the work on my nonprofit boards, and I was usually in a leadership role in those positions as well, I've learned a lot that make me really fit for this position.
Thank you. And what were some of the cost-saving measures that you developed when you were over the state employees' health benefit plan?
Well, first of all, we revised the way that the reserve was being calculated. They had a 10-year model, which was a kick the can down the road model, really. And we reduced that and got support from the Healthcare Commission to a 3-year model. We also, which was more realistic, a more realistic view of what our premiums might be, and what the reserve had to be. And of course, we managed to the reserve, didn't do that single-handedly. Of course, we had actuaries in our management team, which was great, and had a lot of experience with that. The other thing we did is when we rebid contracts, one of the main reasons you go out for rebid is you're looking for better terms, cost savings, better benefits for employees, and we were all about better benefits. So the one recent savings we had was on the FSA, HSA savings, and I don't remember exactly the terms, but because we were able to renegotiate that, we got better terms for our employees on that. We also, sometimes by extending contracts, you get, if you wanted to extend or renew with the same vendor, they always sweetened the pot, seemed like, and so we were always looking for doing that. We had contracts that felt like just about every month we were trying to work on from an RFP perspective or renewal.
Just to follow up on that, so when you talk about extending, you're talking about extending outside of the contract parameters, or?
No, through the parameters. Through the parameters. They all had a clause of what you could and could not do in that regard. We followed that.
Okay, thanks. And then I know that I think you'd mentioned in your materials that I'd read that when you're looking at the future of KDHE, about how you can work to intertwine the 3 silos. Can you expand on that?
Yeah, I gave an example a minute ago of the public health, some of the mothers initiatives, women and children initiatives, and some of what we do in the committee work in our health promotions department and in WIC. I think there's a lot of opportunity to tie some of that work together. And I just met with the Lung Association the other day, and they work with our Environment Division and our Public Health Division. And I was very excited to see that, and I'm putting things together in my mind about what we can do. I see that for a couple things. Efficiency, back to that. But I also see it for this unfortunate staffing crisis that we're facing, like the rest of the country. But we do have staff deficiencies in our agencies. And if there's an opportunity to fix that through collaboration and more interconnection, I'm excited about that very much. So that's an example for you. Thank you.
And I'm just wondering, do you think that our health departments in our counties are used to their ultimate advantage? Or do you think that there's a way to, I think sometimes they're not only underfunded, although we've been doing last year and hopefully this year we'll be improving their funding, but I think they're sometimes looked at not as the opportunity that they provide. Do you see a way of raising their, or the community opinion of our health departments?
The community health department They've been a focus of mine since I've been here because we work so tightly with trying to provide them guidance, funding, supplies, whatever, during COVID. So I'm coming at a time when actually the relationship's been tighter between the county health departments and the state, but there is no, legal oversight. They manage their own. I recently also met with all the chief medical officers from across the state, from all the health agencies, had a great discussion with them about what we could do more, be loose still, nothing formal, but what we could do to meet and keep them better informed and hear what their needs are to see if we can't fill each other's holes and support them in a different way by providing information. So yes, to your question, I do see that there's some opportunity to help them more.
Thank you.
Thank you.
Madam Secretary, Senator Baumgardner is not here. She had texted me
Okay.
3 questions that she wanted to ask. So I'm
Okay.
gonna go ahead and ask hers before I get to mine.
Okay.
One of her questions kind of piggybacks off of one of mine. The first question that she had was, throughout our agency budget hearings, travel funding increases have been requested with the reason being that the pandemic is over or has ended. When did the pandemic end?
The pandemic has not been declared over by the CDC or the government yet.
What about by the state?
It has not been declared over.
And then the second question is, what biology, pharmacology, and immunology courses did you take while obtaining your undergrad and graduate degrees?
I took anatomy and physiology, microbiology, and chemistry.
Okay. And then this one kind of piggybacks off of mine, so I'm going to add to it just a little bit. Her
Okay.
question was, how will your leadership be different from your predecessor?
I didn't work under the predecessor, so I don't know what his leadership style was. I have described what mine is, so I'll have to leave it at that.
So going into mine, then using that, looking back, what would you have done different if you were the secretary of KDHE during the COVID pandemic?
I again wasn't here, and I was at the state, but I wasn't really involved in anything KDHE was doing. I think it's difficult for me to answer because it's always hard. It's easy to, think you would do something different. I think I told you what I'd do going forward and what I've been doing for 3 months, which is immersing myself in up to the elbow work, and I do that as a regular part of just how I work because I enjoy working next to my team and other stakeholders. So that's the go forward, and I can't emphasize enough how important ongoing and authentic communication is with people, and that's another thing I'll commit to.
Okay. Apologize, I'm not going to let you off the hook.
That's all right.
Because that didn't answer my question. Hindsight is always 20/20. Whether you were there or not wasn't the question. The question was today, knowing what happened during the pandemic, today, you're armchair quarterbacking that situation. What would you have done differently? Not specifically what
Okay.
previous secretary did, but what would you like to have seen done differently now that we have a chance to look back?
I would have gotten more direct engagement with stakeholders.
Okay, thank you.
Thank you.
One of the things that I think, unfortunately, in society we're lacking currently is we are not encouraging independent or critical thinking. A lot of times it's just who can parrot the talking points the best. How would you rate yourself as being an independent and critical thinker when it comes to data and information, especially new data?
I would rate myself as high. My background is in health informatics, as well as I was a chief information officer at Stormont Vale, where I managed all of the IT systems and had quality review and utilization review under my area of responsibility in all hospitals I worked at. analyzing data and being able to present it to audiences such as the medical staff, regulatory agencies, and so forth, knowing when to present it and not to, and being able to cut to the chase about what the data means. I think I'm very skilled at that.
And my final question is, along those lines, we saw a lot of one-size-fits-all, and that's why I think that independent and critical thinking was put back a little bit. But in every community, you had some that thought that government didn't go far enough. Then you had those that thought government went way too far. Thinking on those lines, going into the future, and I know you talked about getting stakeholder input, but the question was asked earlier that you work for this, and you answered you worked for the citizens. So ensuring that the citizens, I'm going to quote, and I might get it wrong, a Ben Franklin quote that's been quoted quite often is, when you give up freedom for a little bit of safety, you deserve neither. And so there has to be a balance, at least somewhere, because a lot of people, and myself, I fall into this category, is our freedoms are God-given rights, not government rights. And there was a time where churches, you had to close church and weren't able to attend your church. To someone like me, that's a big deal because my faith is very important to who I am. And without that, I think this world's a struggle. So do you ever think there's a time that we should sacrifice our freedom to go to church or to worship our faith as we see fit in order to protect the health?
I think that, first of all, we have to look to protect the safety of people. If that was a case where there was guidance that came about, it would be just guidance. There would be no mandate. There is no mandate on that would prevent you from having your freedom to do that. I think that if there was a case of an outbreak in a church and there was something that was in line with our statutes that said we had to investigate or temporarily close something while an investigation was being done, that would be the extreme case, but that I don't have a better answer than that for you. I'd have to follow the statute and the guidance.
Senator Gossage.
Thank you.
Thank you, Mr. Chair, and thank you. It's good to see you again. We spent extensive time yes, having questions, but I'm going to ask you some of the same questions just so that the listening audience can hear some of the answers that you gave to me. So one would be, you are replacing Dr. Norman, and one of the questions I ask you is, as a secretary, you're not a medical doctor, and you explained to me why you didn't need to be. Could you share that now?
Yes. I have a team of medical professionals. I have a chief health officer that I referenced earlier, and I have a team of epidemiologists, nurses, and other professionals, professionally licensed staff. I do things in a team effort. I mean, we'll pull the team together. It was not unlike what I did in my hospital role. I had many people on my team that had the expertise that I did not clinically, and that's why I feel I'm qualified to do this.
All right, thank you. And then you mentioned that you, of course, have been a manager of many different organizations, including hospitals. And how is it that you feel that being a manager of that equates to your eligibility for this position?
And the management is management in many ways. So I'd say 80% is about management, and then 20% maybe for me is the rest, because of my years of experience and all of the different places that I've worked and all of the different areas that I've managed. And my work with policy and having to interpret and administer administrative regulation from the federal and state government and other regulatory bodies makes me well suited for it.
Thank you. You know, we seem to be moving to a very distinct difference in how people view our government. There are some that want us to move more to socialism. There are some that want to maintain our constitutional republic. When it comes to the side that wants to maintain the constitutional republic, they look more to personal responsibility, private answers to problems as opposed to government answers to problems, allowing Kansas to keep more of their hard-earned money. And that way they can be more charitable to their neighbors rather than charity always coming from government. And government picking and choosing and letting society, and the difference between society and government. The reason I'm asking that question is some of the folks that I know who have majored in population health or government health see it's the phrase, if you carry a hammer, everything looks like a nail. If your degree is in population health or in population health department, everything looks like we need to fix this. This is something we need to look at as government. So that's a long lead into a question is, do you see a difference in whenever you look at something or you look at a problem, do you feel that you could look objectively as to how could this be resolved? Maybe there's an area that needs more health care available to the citizens in that area. Perhaps doctors can donate. We see that in Johnson County. There are doctors who donate their time to community centers 1 day a week. It's just been working out very well. That was a private solution as opposed to more government getting involved. So again, my question is, how do you see that? Do you see a possibility that you could look at private solutions to problems that may come your way?
Oh, absolutely. I'm very objective in that regard. I also know that one size doesn't fit all, and I would never assume that the government would take care of everything. One of the reasons I want to get to know who our stakeholders are so I can connect them or connect solutions for people that is outside of what the government can do. And there's so much opportunity for that. As I noted earlier, the state is big and made up of many different communities and resources. And whether it be figuring out if there's bus passes for people in a community that have nothing to do with the government, but getting them a ride so they can get to their doctor's appointment or get their WIC, supplies or whatever it might be. I think there's a lot of opportunity for that. So yeah, absolutely on that.
Thank you. And when I think of success, and others that would agree with me, is that success when it comes to government programs is getting more people off of government programs and letting people become more independent. And that is ideally our goal. Yet sometimes when there has been a press conference, it has almost been celebrated that more people are on this government program, or we signed up more people for whatever. Not to say people don't need help, but maybe the goal should be how do we help people be better educated, they could get better jobs, how do we help the economy, to look at how can we wean people off of government assistance and help them to be able to work on their own 2 feet, be able to make a living, have pride in what they do.
Well, I think there's a couple examples. We had a program at Stormont Vale that was working on that very thing, trying to get people into the workforce so that they could get independent and not come into the ER anymore, for example, for their care, get them a job on insurance and help them with that type of thing. I think the other program you may or may not be familiar with is the STOP program that's included in the Medicaid plan that we have right now. The last I knew, there were at least 15 people enroll, and that is a workforce program where we are helping enrollees in Medicaid get into the workforce and into a job. And that's an example of what you're talking about. So if there are opportunities to do that, absolutely. I think to your point about celebrating more people getting onto programs or enrolled or whatever in whatever it might be, I think from KDHE's perspective, part of that is what we do because we're looking at safety and health, and we want people to have improved lives, and that's a way to do it right now. But to your point of looking for more opportunities like that, I absolutely would do that.
Thank you, Mr. Chair. Thank you.
Thank you, ma'am.
Senator Holscher.
Thank you. Good morning. Thanks.
Thanks.
In Johnson County, there's been a real focus on mental health, especially with teenagers, and we've seen a reduction in teen suicide over the past few years. I have 3 teens myself, so I'm close to the prevalence of social media and its impact, and aware of the avenues that are present for bullying and other issues that have an effect on mental health. what do you envision KDHE can do to help us moving forward in that regard?
Well, I think we would look into our, and I don't have all of the activities memorized yet, what we're doing, but look into whatever work we're doing with our mental health coalition and find out from there what initiatives are on that list. I know suicide, obviously, is a big part of that, but related to social media and maybe broadening how we help our children and their parents, for that matter, with this growing issue would be one way to do that. I think also back to the interagency connection would be working with KDADS and DCF and finding out there if there's not some synergy that might exist. And then obviously within our population of the Medicaid, which is another group of teens and children, finding out what programs are there, what are we working towards with our MCOs and so forth.
Do you envision any type of PSAs or anything in terms of helping educate parents about, like I said, some of the apps and some of the things that can have an effect? I know I've talked with several of my peers, and
Senator Holscher, I don't think you're coming through on the mic. I
I'll move
apologize.
closer,
Could
sorry.
that's for people online. Thank you.
thank you. I was asking, do you envision any PSAs or anything in terms of helping educate parents in regard to potential dangers with social media? I know I have talked with a couple families back home, and while they check their kids' phones, often there are disappearing chat rooms and areas where they can't even find the evidence of bullying when it's occurring. So I think sometimes maybe parents just don't know what they don't know that's out there. So do you envision any way of helping, like I said, parents in that regard?
Right, PSAs is one method, but I envision also working with the schools and other children or teen-related organizations that we may be able to network with and kind of commingle or co-brand our PSA or our program or our educational session and so forth. So back to using those stakeholders differently, I think that that's a huge opportunity for KDHE.
And then the only other thing was, I noticed, based upon your experience, you have a lot of IT background. Have you noticed, I know it's only been 3 months, have you noticed any improvements at this point that you feel could be made in regard to software, IT, and some of that processing?
We've had just one change, an upgrade in a system that's been going on in the vital statistics area that's been very successful and just went live. So that's one. I think you may or may not know that Medicaid, their system is undergoing a major upgrade. It's a modular system that's being put in place over there, so different modules that will help both efficiencies and help members with enrollment or processing or whatever. But I think that, there's always room for improvement in IT. And I tell people it never ends. You put something in to fix, but there's always upgrades and updates that need to be done. I would say that in KDHE, there are some opportunity for some of the systems to automate and so forth. And also, I'm trying to better understand what's allowable from a firewall and security perspective, but I'm too new to quote too much on that right now. So, thank you, though.
All right. No, thank you very much. And does your husband make dinner?
Yeah, he does. He's a good guy. Yeah. I'm lucky. I got a good one. So.
You'll give him credit on some things, and thank you.
Senator Stefan.
Thank you.
Hello.
Good to see you today.
to see you.
Appreciate being here. Some of my questions, the bad part of being last is some of your questions get asked, so bear with me, there'll be a little bit of redundancy. I'm going to try to stay more on the edge of the public health and individual rights and individual health freedom type of issues. And again, I was going to lead off with asking what the extent of your medical training was, and you're not a medical doctor, correct?
That's correct.
Okay. Who makes your medical decisions for you? I know you talked about that a little bit, but it was very broad. Do you have a name of the lead decision maker for you?
Well, our state health officer is Dr. Joan Duvey, and she's here today. And then we have our epidemiology team, Dr. Farah Ahmad, you might have met, and then a number of them. But we do it in a group decision.
Okay. Has the Senate or the people of Kansas vetted any of these people?
Not to my knowledge in this formal way.
Right, right. One of the things that really gets out to me is, and particularly since we talked last, it wasn't that long ago that you were here.
Right.
Some issues were raised. We talked about educating citizens on early treatment of COVID. And, but, particularly, you've been in this interim position while cases skyrocketed. And did you do anything to help people understand what their early treatment options were, particularly knowing that the oral antivirals and the other I'm blanking all of a sudden. The other medications were very, very rare. Did you do any educating, any public service announcements in regards to early treatments?
No PSAs, only reference to the CDC and AMA and other guidance about where they can learn more about those early treatments.
So again, we're back to these larger state or federal government agencies making all our decisions for us. When it comes to the COVID shot, we talked about how, and when you came to my office, we talked about the problem that KDHE was basically saying safe and effective, safe and effective, safe and effective, when we have a CDC VAERS reporting system that ties 20,000 plus deaths and more complications to these shots than all the other vaccines combined. What have you done since we saw you last in regards to correcting that lack of a balanced approach, to obtain true informed consent?
Well, I believe true informed consent was being obtained like it is for any medical procedure or vaccination. One thing we've done is revisited the ads, which were brought up by many of you, and we have removed the TV ads, and we are making sure that in reviewing all of our ads that if we do have an advertisement or something that might mention getting a vaccine, that there is a link, and we are encouraging people to follow up with their doctor, following up with their check here if you want to look into more of this. And again, the CDC is our reference point in a public health agency.
Well, and I appreciate that. You do need to continue to push towards a more transparent, informed consent. And in that vein, the difference between public health and individual rights, as public health treats a society, right?
Treats the people. Mm-hmm.
It treats people as a society where we, husbands, mothers, fathers, take care of individuals. Are you comfortable with the concept that individuals have to be sacrificed for the well-being of society?
I don't know what you mean by that question, sir. I'm sorry.
Well, like pushing vaccines so hard. You knew people were going to be injured. You knew people were being injured. And yet we didn't hear anything about that. That's a perfect example of supporting the greater good over the individual.
I can only refer back to what was published by us to get people to talk to their doctors, check on, CDC website about what was published about things. So
But you would agree that that's a pretty dicey situation to sacrifice individuals for the greater good of the society. So I do encourage you that you're in a territory that you're not used to in that aspect of it. You've been on the health administration side, not that side of it. Be careful. That's a very, very delicate area to jump into. Do you support Kansans losing their job if they do not take the COVID shot?
that's up to the employer. I mean, we don't mandate whether they take this.
Personally, do you think it's okay? From what you know scientifically, do you think that's wise?
Having people sacrifice their job over not getting the shot? Is that what your question
Or
is?
say, should they lose their job if they don't take the COVID shot?
I think it would depend on what kind of industry is making the decision to make that type of decision. And I think the exemption is there if they chose to exercise it.
Senator Stefan, 5 minutes, so, or up, so if you could wrap it up real quick.
One
please.
more, and to take this globally, you talked about your 10th item being the future of public health. I would put forth that there is no future for public health if you all are not able to look back and do a post-mortem review of what went on over the last 2 years, because there's been so many failures that you can't move into the future. And I would ask for you to tell us that you will provide this committee a post-mortem written review of the decision-making processes through the pandemic and what lessons were learned from it. Can you do that for us?
Yes, I can, and we have a plan on what we're going to be. I noted earlier that, just to close, we were looking at, and I was personally looking at things we did before the pandemic, things we did during, and whether or not we'll do those things afterwards, or the way that we'll do them, and that's on my top 10 list. Thank you.
Committee, thank you for the questions. Madam Secretary, thank you for
Thank you.
being here. Our time is almost up, so I just want to reaffirm what we're doing. We're not going to vote today. We are going to vote tomorrow, and our options, we have 4 options. Pass out, recommended to be confirmed by the Senate, no recommendation, or to recommend not to be confirmed by the Senate, or take no action. But we're not going to do number 4. We will take action. So actually, we only have 3. So with that, if there's nothing else to come before the committee, we are adjourned.
Thanks for your
Thank you.
consideration. Bye-bye.